Hi, my name is Elaine. In the last two videos, we discussed how to promote your flu campaign and implementing an appointment-based flu shot model at your pharmacy. Today, we'll be going through the steps to safely administer the flu vaccine during the COVID-19 pandemic. One of the most important factors to account for during the provision of flu shots this year is the physical setup of your pharmacy. There are a number of strategies you can implement to maximize the safety for your patients and your staff. Throughout your pharmacy, there should be visible and clear signage reminding patients to physically distance and to wear an appropriate face covering. Signage, floor stickers, ropes, and/or dividers should be clear to maintain unidirectional patient traffic and distance between chairs in the waiting room. Patient chairs should be easy to wipe, such as plastic or metal. Avoid using chairs that have fabric cushioning. Patients should be advised to wait in their vehicle or have a designated waiting area that is adequately distanced from other areas of the pharmacy. Some pharmacies might consider preparing an outdoor waiting area as well. Patients should be advised to arrive on time for their appointments and not earlier. Now, let's get into personal protective equipment, aka PPE. In preparation for the patient's appointment, the pharmacist should always don PPE as appropriate. The following has been recommended by the Canadian Pharmacists Association. A face covering should be worn by both the pharmacist and patient. If the patient does not have a mask, the pharmacy should be prepared to provide the patient with one. Eye protection in the form of goggles or face shield should be worn and be disinfected following each injection. Gloves are usually not required for flu shots. If worn, they should be replaced following each injection. A gown is not required. Your mask and gown can be worn throughout the day or changed at your rest periods. In all cases, pharmacists are encouraged to apply their clinical judgment and perform a point-of-care risk assessment prior to seeing each patient to help determine the type of PPE required. On the morning of the injection, since you will know which patients will be arriving and when, you can print out the documentation ahead of time and pre-fill some information such as lot numbers and expiry dates. Since patients have filled out all the documentation ahead of time, the incidence of no-shows should be significantly reduced. You may also want to have a system in place for calling patients that have appointments that day which haven't yet confirmed or completed their COVID-19 screening. If you're using MedEssist, you can easily see which patients have confirmed their appointment and have completed their COVID-19 screening in the daily view. As a team, your pharmacy will want to decide on whether you would like to administer flu shots within the pharmacy, at the patient's vehicle, or off-site if your provincial regulations permit. MedEssist supports off-site and in-vehicle injections by being accessible on a laptop or tablet. We can also activate an entirely separate off-site account with different schedules and patient instructions. Now, let's talk about in-pharmacy injections. For appointments taking place within the pharmacy, ensure that high-touch surfaces and seating in the injection room are disinfected before and after each appointment. According to the CDC, most commercially available cleaning solutions are adequate. If you have trouble finding cleaning solutions, you can also use a diluted bleach solution. This can be prepared by mixing approximately 4 teaspoons of bleach per liter of room temperature water. The pharmacist should drop the vaccine before patient interaction. Policies and procedures should also be communicated from a distance of at least 6 feet away. If you have a larger injection room, you can mark the space with tape or a divider. If you have a smaller room, provide all your instructions before entering the room. From a distance, the following should be communicated prior to beginning the vaccination procedure. Informing the patient that once the vaccination procedure begins, there will be no talking by either party. Ensuring patients provide consent and do not have any questions before beginning the vaccination procedure. Verbal consent to the flu shot is recommended. A signature is not required to reduce transmission risk. Instructing the patient to sit with their arms relaxed by their sides or on their lap. Instructing the patient to face away from the pharmacist for the duration of the procedure. Now you can go ahead and administer the flu shot safely and efficiently. If you're conducting in-vehicle injections, a sufficient number of easily accessible parking spots should be reserved exclusively for flu shots. If you're unable to reserve multiple parking spots, you may want to consider conducting in-pharmacy injections while having patients wait in their vehicles or an outdoor waiting area. Patients should be instructed to call the pharmacy upon arrival and to stay in their vehicles. During this call, policies and procedures should be communicated and patients should be asked to describe their vehicle and license plate for identification. You may also ask patients to move to a passenger seat to discourage patients from driving away just after the injection and to open their car door to provide adequate space. A cart of required equipment should also be taken to facilitate vaccine administration, including alcohol swabs, a sharps container, and any other additional materials required. Now you're ready to meet the patient at their vehicle to administer the vaccine. Following vaccine administration, the pharmacist should maintain a distance of 6 feet from the patient, including when providing any follow-up information. In the majority of cases, patients should remain in the pharmacy or their vehicle for 15 minutes after administration to monitor for potential side effects. Additionally, a record of the immunization should be provided to patients to help them keep track of their vaccinations. With MedEssist, patients are automatically sent an electronic receipt of their vaccine administration after their appointment. This year, we do not recommend conducting walk-in flu injections as you'll have less control over your workload and environment. It can also set the wrong expectation in how much risk we as a profession are taking in providing the service to the public. There's a couple ways MedEssist helps reduce demand for walk-in services. First, by proactively registering patients and starting flu promotions early, you can have the majority of your patient population in nearby community already registered before doses even arrive. Secondly, MedEssist also allows you to quickly schedule patients seeking a walk-in flu shot. This ensures your patients don't leave empty-handed when there are vaccine shortages. Finally, MedEssist enables you to move any high-priority patients to the top of the waitlist with the click of a button, so you can make sure those that need it the most can access the vaccine first. If your practice environment still requires that you accept walk-ins, MedEssist can help facilitate walk-in flu shots by enabling patients to complete their documentation on their mobile device at the pharmacy. You may want to increase the interval time between appointments, which will help you account for walk-ins. If there are supply issues or long wait times when patients walk in for their flu shots, MedEssist can help bring those patients back to your pharmacy with a fast and simple registration process. MedEssist also helps you manage inventory for both walk-ins and appointments. You can easily subtract doses from your inventory for every walk-in injection. This way, you'll never accidentally give away a dose that another patient has reserved. We hope that this video series has given you the confidence to tackle the unique challenges of this year's flu season. We know it's been a long couple of months for pharmacies, and we're proud of the fantastic job you all have done adapting to the pandemic. We're happy to be able to help you rise once again to this new challenge. Please visit our website to learn more about the MedEssist vaccinations platform, which allows you to manage all your flu shots in a simple and automated way. You can also book a meeting with one of our advisors who can help you develop a personalized plan for conducting flu shots at your pharmacy. Thank you and stay safe.